I'm a stroke neurologist or vascular neurologist, so I see patients in a number of different settings. I work in the inpatient department on the stroke service, both here at Cleveland Medical Center, which are really the sickest of the sick patients that come from all over our health system. But I also work at one of our community hospitals on the east side, where I see slightly less sick but hospitalized patients with stroke. And then I have an ambulatory practice, which is a stroke prevention clinic. I see stroke survivors who are dealing with some of the aftermaths of their stroke, as well as individuals who might be at risk for a stroke and want to have a discussion about what they might be able to do to keep themselves healthy. At university hospitals, I work with a great team of individuals. Neurosurgeons, cardiologists, interventionalists, rehab specialists, neuropsychologists, therapists to help people get back on track. It's just a wonderful team. To really treat a stroke, you want to prevent a stroke. Stroke may not be one of the leading causes of death anymore, but it still is a major cause of disability in Americans. Looking at a patient's risk factors, their profiles, what they can do to stay healthy and prevent a stroke.